And welcome back, everybody. I want to introduce you to Dr. Kent Hasen. Good morning.
Good morning.
And his patient who's here with him, Ashley Wilkerson. Good morning, Ashley. Dr. Hasen is a board-certified plastic surgeon, and I know that you stay up to date with all the latest non-surgical cosmetic treatments. And now Dr. Hasen is here. He wants you to know that he's the first and the only doctor in the Fort Myers, Naples area with this. Show this, Dr. Hasen. This is the newly FDA-approved CoolSculpting. The machine that will actually freeze fat cells, freeze them from your body. It did. There it is right there.
Yeah.
This is CoolSculpting. He's the one with it in his hands. He can freeze the fat right off your body, and he did just that, as we'll see in just a moment with the before and after pictures. To Ashley, good morning again, and welcome. And you're the only doc in our area with one of these.
Yeah, it's an exciting new technology. It just got FDA approved about 2 weeks ago. And so it's really become a big thing in our practice.
What does it do, and how do you do it?
Well, we apply this to an area, troubled areas on people. So it's really ideally for people that are near their ideal body weight, who work out at the gym, who try to diet and exercise, but they have small spot areas that can't be treated. And in the past, we used to have to resort to liposuction for that. But the problem with that is, you have surgery, you have anesthesia, you have downtime, recovery, and this is great because it can be done and you could work out that same night.
Well, I got to ask Ashley. Ashley, I know the doctor's sitting here right beside you. Did it hurt? What was it like? What was the experience like?
There was no initial discomfort. I was prepared for bruising and redness and tenderness. I didn't experience any bruising with my procedure, but I did have the swelling and the tenderness, but it wasn't painful by any means.
Since it is actually freezing the fat cells, does it feel cold? Does it feel like ice?
It's cold for the first 10 minutes, and then you're frozen from there.
Yeah, it becomes numb, basically.
So for the next 45 minutes, you just sit there and you can read and watch TV, work on the laptop.
Yeah.
And you lie there for about an hour, and then in a month to 3 months, you see results.
Yes, it does take some time to see the results. Initially, you actually get a little swollen right afterwards, but then a couple, after about 4 weeks, you might start seeing some change. But it really takes about 2 months, maybe 2 to 3 months to see the real results.
Let's take a look. This is a one end of the machine. This plugs into the machine right here. What is this?
So that's the actual machine that creates the cooling to the patient. We have multiple heads like this one. There's actually a much larger head that has just gotten released, and we're getting it this next week, and that covers the whole lower abdomen. In the past, for like somebody who needed their whole lower abdomen done, it would have to be 2 cycles, so 2 hours, whereas this covers about 2.5 times that. So you can get it done in 1 hour instead. So
now I'm a workout fiend, but I know no matter how much you work out, these love handles, you're born with them. I'm prepared to go to my grave with them. This works for guys too. Take a look at this picture of a good-looking guy and his midsection. Not really paunchy, but he certainly got some results there on the right side.
Yeah, and actually that is me.
Well, congratulations.
I'll admit that. But,
you froze yourself.
I froze myself. I was the guinea pig the first when I was training with it. That's how I learned how to do it. And my experience with it was similar to what Ashley said. It felt really cold at the beginning, and then it froze up, and then it was just numb. And then it comes off, and you can even touch it right after it's done, and it doesn't even feel like it's part of you. It's totally numb for about 15, 20 minutes. It's kind of red. Some patients that are real thin, that just have that little area, they can sometimes get bruising, more in like women I see, but even that usually goes away after about a week. But literally people can walk right out of there and resume their normal activity. People work out that same day.
You worked out the same day?
Yeah. I actually did.
Did you really?
Yeah.
Well, let's take a look at another picture. We'll call her Brenda. This is Brenda's body, and look at the results that she got.
Yeah, it's just amazing. It was, again, the lower abdomen was done with her. We did like 2 of the cycles across the lower abdomen and 1 above the belly button. And so she had 3 of the cycles, and just a 3-hour period, and she got that result with 1 treatment. Now, some patients that are bigger, they might require a second procedure, and we assess that usually at 2 or 3 months. We have them come back, get some photos, take a look, and see what they think. You know, if they're happy with it, then we're done. But otherwise, you know, we can always do more. It usually reduces about 25% of the fat layer. So, you know, if your fat layer is really big, it's going to reduce it 25% the first time, then another 25% the next time that you do it.
But that subtle difference makes such a big difference.
It really
Here's
does.
what literally is going on. Explain
Yes.
this to us, doctor.
So what's going on is fat cells have been shown to be much more cold sensitive. So the idea is it applies this cold to the fat, and then these ice crystals form into the cells, and that actually kills the cells. The cells don't immediately like shed and let out all the fat material in them, but it takes your body a few months to remove them. And then as the fat cells are removed from the area, the whole area falls down like that. And that's how you get that 25% reduction in the fat layer.
Ashley, did you know all that was going on in your body?
I was watching and learning.
Let's take a look at, this is Ashley. This is before on the left and after. Doctor?
Well, you know, with Ashley, she's actually really fit. She has very small area of fat in that lower belly button region. But she's somebody who works out, who eats right, and is really close to her body weight. She's a perfect candidate for it. And you can see the results that she got. It really just changed that small amount and made a big change there.
Ashley, what did you think of your results of your new body?
I'm very happy with my results. I'm very happy that I went through with the procedure, and I would do it again. That's for sure.
Yeah, and no doubt there are many of you who would like to contact Dr. Hasen at Aesthetic Surgery of Naples, and you will especially want to talk to him after he gives you a great offer, and you get it only because you're watching the Morning Blend this morning.
That's
Doctor?
great. Well, we're giving free consultations to patients that want to come in to discuss this procedure to see if it's right for you, and then as well $200 off your treatment. And so treatment areas are usually about $1,000 to maybe $2,000 per area, depending on how many cycles are done.
It takes about 1 hour at Aesthetic Surgery of Naples. Dr. Kent Hasen will be happy to talk to you, and it won't cost you anything.
No.
If you mention the Morning Blend.
Sure.
And you can go home and work out. And may I see?
Sure,
it?
you bet.
And this is it right here.
Yeah.
This is what Dr. Hasen uses to freeze the fat right off your body. Thank you so much, doctor, and congratulations, Ashley.
Thank you.
You're looking great, from gorgeous to goddess. Pretty good. Thank you,
right.
doctor.
Thank
We'll
you.
see you again soon.
bet.
Carly?
It doesn't get cooler than that. Freezing fat. Well, hey, fall is here. You know what that means? Flu and sickness season is also here. But this man's going to tell us the products we need in our medicine cabinet this season to stay healthy. Stay with us.